What we're doing now is, trying to see what types of exposures, things that people did while attending the fair to see if there are any commonalities.
Health officials continue to search for the cause of an E. coli outbreak. Good evening, everyone. Thanks for joining us.
Now, today, the North Dakota Department of Health reported a fourth confirmed E. coli case in connection with the Red River Valley Fair. Valley News Team's Christine Stanwood brings us up to speed on this growing outbreak.
3 cases of E. coli were confirmed on Monday, all involving people under the age of 18. Now, a 4th case, again within the same age bracket.
And when you're looking at kids, particularly younger kids, they do have a tendency to put their hands in their mouths, and that's a route of infection as well.
Feist says the first step in finding the source is to look for commonalities of the infection to find the direct source of the outbreak. She adds that prevention is key if you do decide to attend a fair with animals present.
What we want them to do is make sure that they're washing their hands after having contact and visiting those areas, and making sure they're not eating in and around those areas as well.
While the Red River Valley Fair is the source of the outbreak, that doesn't mean that people who attend fairs are at a higher risk of becoming infected.
We usually don't see outbreaks like this in association with attending fair. So just going to a fair doesn't necessarily put you at increased risk for acquiring an infection.
Would you know if you had symptoms of E. coli?
The symptoms would not be good. I think would be a lot of intestinal pain, probably, a lot of discomfort.
The good news is that the incubation period for getting E. coli is nearing an end. But Feist says she wouldn't be surprised to see more cases. Get a hold of your doctor if you attended this year's fair and have symptoms of abdominal cramping, nausea, vomiting, and diarrhea. In West Fargo, Christine Stanwood, Valley News Live.
Fair officials tell us they continue to work with the health department in trying to locate the E. coli source.